So this is maxilla bone. We have a right and left, two maxillars, and they form the upper jaw. Upper jaw, and these are the bones of the face or facial skeleton. And the upper jaw is fixed. Only lower jaw moves. So you can see this is the skull and this is the maxilla, and both of the maxilla, right and left, they unite in the center, and this is the anterior nasal aperture, and these are the two nasal bones. So this is the anterior nasal aperture, and when you explain the maxilla, you have to hold it in anatomical position. Fine. If it is right maxilla, you have to hold it in the right hand. How will you identify the side or side determination? So you can see this is the teeth bearing area or teeth bearing border. We call it alveolar border or alveolar process. It should be downward or inferiorly facing, and this is the prominent process is the frontal process. It should be upward. This one more process, that is the zygomatic process, it should be on the outer side, or you can say on the lateral side. And here one more process you can see, this is the palatine process, which is medially. So, and this is the anterior notch, it should also face medially. So this is the bone belongs to the right side or right maxilla. Same you can see here, this is the left maxilla. The alveolar process or teeth bearing area is downward or inferiorly, frontal process is upward, palatine process facing medially, and this is the zygomatic process which is laterally. So this is regarding the side determination, and this is an irregular bone and largest pneumatic bone because it has a cavity, that is the maxillary cavity in the body of the maxilla. That is the largest air cavity. So this is the pneumatic bone. So it is irregular and the pneumatic bone, and it ossifies within the membrane. So it has a membranous ossification. Now the parts of the maxilla. The maxilla, it has a body which contains maxillary sinus, maxillary air sinus, and the body, it has a anterior surface and a superior surface, which we also call orbital surface, and posterior surface, which we also call infratemporal surface. And this is the medial surface, which we also call nasal surface. So these are the surfaces of the maxilla and the processes. This is the frontal process upward, this is the alveolar process, and this is the zygomatic process, and here you can see the palatine process, which is on the medial side. Now regarding the detailed structure of the surfaces, for example, anterior surface, here you can see this is the prominence, this is known as the canine prominence, and there is a depression which is known as the canine fossa. Same here is the incisive fossa, and anteriorly you can also see a notch which is known as the anterior nasal notch. When both the maxilla they unite, they form the anterior nasal aperture, and there is a prominent spine, anterior nasal spine. Now on the posterior surface, on the anterior surface, there is a foramen. You can see this is known as the infraorbital foramen. Infraorbital foramen, through which this is just below the infraorbital margin, infraorbital foramen. Infraorbital nerve and vessels pass through this foramen. Fine. So this is the infraorbital foramen. So these are the structures on the anterior surface. When we come on the superior surface, you can see this is the orbital surface or the superior surface, which form the floor of the orbit. Floor of the orbit. You can see in the skull, this is the floor of the orbit. This is the orbit and this is the floor of the orbit. Okay. So here you can see there is a groove. Then there is a canal. And this canal leads to infraorbital foramen. Fine. So in this groove and then canal, then infraorbital foramen, there is a infraorbital nerve. That is the continuation of maxillary nerve when it passes through the infraorbital fissure. So this is the groove, infraorbital canal and infraorbital foramen. So this is the superior surface of maxilla, which form the floor of the orbit and the structure passing through the groove, canal and the foramen. Here you can see there is a notch, and this notch is the lacrimal groove. Here the attachment of lacrimal bone forms this nasolacrimal canal through which nasolacrimal duct passes. Okay, so this is regarding the anterior surface, superior surface. Now come on the posterior surface. So posterior surface, on the posterior surface, this is the basically infratemporal surface, because it forms the boundary of the anterior boundary of the infratemporal fossa. You can see this is the lateral view or norma lateralis. Here you can see this is the posterior surface of the maxilla, and there is a fissure, pterygomaxillary fissure, which leads to pterygopalatine fossa, and this is the pterygoid process of the sphenoid bone. So the anterior surface or anterior surface of the infratemporal fossa, anterior surface of pterygopalatine fossa, both are formed by the posterior surface of maxilla, right? And this is the pterygomaxillary fissure. Here you can see one important structures, the small foramina on the posterior surface, because they are on the posterior surface and they are above on the superior alveolar border or superior alveolar process. We call them posterior superior alveolar foramen. 2-3 small foramen. I will show you. I will show you some better diagram. This is broken actually. This is the small posterior superior alveolar foramen through which posterior superior alveolar nerve and vessel passes. Fine. And now